Good afternoon.
Good afternoon.
Good afternoon.
And welcome to the 6th Annual Pathways to Hope Conference. My name is Bill Glenn, and I will be your workshop session moderator. Please share your first name and zip code and any speaker-specific questions and comments in the question and answer box on the lower section of your screen. Again, welcome to everyone, and let's get started with a little housekeeping. If you are attending the conference and receiving community education units or CEUs, please listen carefully. All registered attendees seeking CEUs must remain in the session for the entire duration. These sessions are approximately 75 minutes long, and so 1.25 CEUs will be issued upon approval in the areas of LPC, LMFT, social workers, and psychologists. Each attendee can qualify for a total of 4 CEUs, eligible workshops Friday through Saturday. Post-session survey is required, as well as a daily conference evaluation. For those joining us out of state, please follow our CEU instructions, but it will be your responsibility to seek final approval from your state's credentialing board. We are grateful to have the support of NAMI Texas Bexar County Recast Project for making these CEUs available. Again, all registered attendees seeking CEUs must remain in the session for the entire duration. So now it's my pleasure to introduce the speaker panel, and we'll begin the chat. I'd like to begin by introducing you to Brandee Perez. Brandee is the San Antonio Housing Authority Chief Operating Officer. She's leading the Federal Housing Program Department, Community Development Initiatives Department, and the Safety and Security Department, 2 of which are the agency's largest departments. Under the portfolio, she oversees a staff of nearly 400 and assists in managing a budget of nearly $200 million. She's a San Antonio native, and she's been employed at SAHA since 2005. In February of 2017, she was named to the Center Advisory Committee for the Center for Healthcare Services. And in 2018, she was named as one of the 5 Housing Choice Voucher Directors, and that you should know about in Housing Futures. Next, I'd like to introduce Mark Wittig. Mark is the owner of Wittig Office Interiors, and his business has been here in town for as long as I can remember. Mark is the recipient of many honors and awards. He's been, in 2015, the Small Business Leadership Award for Community Service from the San Antonio North Chamber of Commerce, the 2014 Golden Trowel Award from the San Antonio Masonry Contractors Association, and he was at the inaugural Joe Long Award at the Carver Center Development Board, honorary AIA San Antonio title in recognition of his partnership in the creation of the new Center for Architecture. He's been awarded the Hall of Fame from the Archdiocese in 2005, and that was for extraordinary service in Catholic education for many years. He's also received the Menedica Humanitarian Award from the Missionary Catechusts of Divine Providence. Lastly, I'd like to introduce Cecil King. Cecil is with the Center for Healthcare Services. He is currently serving on the board for the Fair Housing Council of San Antonio. He serves on the San Antonio Housing Authority SAFMR Committee. Now let Cecil spell that out for you when he gets a chance. And he's also been selected to testify before the Texas Legislative Budget Committee on the need for housing funding for individuals. Currently in his position for supported housing programs, mainstream vouchers, tenant-based rental assistance programs, homeless preference set-aside vouchers, and supported employment and military veterans peer network programs. During the past 26 years with the Center for Healthcare Services, he's been a troubleshooter for the adult outpatient clinic. And I happen to know that he's also been very much involved in his role as a board member in helping to build some of the housing that we have here through programs from HUD that are purpose-built for persons living with a mental illness. He's also involved with the drug court, mental health court, and he says his passion is housing, and I would agree. We're going to begin with Cecil and let him make some brief comments. Cecil, would you please go ahead?
Yeah, thank you for that introduction, Bill. The SAFMR stands for Small Area Market Rent, Fair Market Rent. As Bill stated, my passion is housing. And for me, I can sum it up by saying that housing, when it comes to recovery, housing is on top of that pyramid. And, you know, the reason being why I feel so strongly about that, I kind of put it into a category where I call the 3 H's. And that first H stands for housing, meaning that when you give somebody a safe and decent place to reside, to live in, that they can call home, they have a sense of hope, which is that second H. And once they start getting that sense of hope, that recovery is possible, and they can start to conceptualize and start to, you know, begin the healing process of healing from whatever it is that they're trying to heal from, whether it's mental illness, addiction problems, medical issue, homelessness, or whatever it is, you know, that healing process starts. Over the years at the Center for Healthcare Services, you know, I've been in the housing arena since 1998. I've done a lot of work with SAHA. SAHA is an integral part of what we do in the community. You know, we have several different programs that we partner with SAHA on, such as the Homeless Preference Set-Aside Voucher Program, Mainstream Program. And we have a brand new program that's getting ready to come online that we call Housing and Support. This is where we're partnering with SAHA. This has been in the making for between 5 to 6 years now. And this is where we will have set aside public housing units in one of SAHA development, and we will have service on site. There will be a full-time supported housing care manager on site. There will be access to intake for new folks that has mental illness and, you know, wants to seek mental health treatment. We'd be able to, you know, get them into the system quicker and get them connected to service and so forth. So I'm very excited about this model. To my understanding, and from speaking in several meetings across the state, this probably would be the first time where your public housing authority and your local mental health authority come together and create some type of a support housing model on where you have services on site. So SAHA and CHCS is looking, you know, forward to this new product to come online. We can't wait for it to come online. Thank you.
Thank you, Cecil. Next, we'd like to hear from Mark.
Thank you, and thank you for having me. If we could do the first slide. Did we lose Brad? Okay. Well, y'all may remember 7 years plus ago, the Pope came and spoke to the Congress for the first time in the history of the United States. And he referenced 4 Americans, and some people felt like that was his Mount Rushmore. And many people knew the first 2, which was Abe Lincoln and Martin Luther King. But Google spiked on the next 2, which was Dorothy Day and Thomas Merton. Thank you. And Dorothy Day is the influential person behind Catholic Worker, which started in '85 in San Antonio as a house of hospitality. And Dr. Chris Plachet joined us 16 years ago. And she's not only is she not drawing a salary, but she's been putting her own money into it this whole time. And it was her vision to go beyond hospitality, but to include housing. And so we created a new board with different skill sets. And that board is Housing First Community Coalition. And the name of that board, says it all: housing first, community, and a coalition, because we can't do it by ourselves. And next slide, please. So this is 17.4 acres off of Dietrich Road, and it butts up to 410 access. The property is situated between 35, 410, and I-10. A site actually that the food bank had looked at before they got the site that they have now. So we're going to have housing for 205 people. Our audience will be over 50 and chronically homeless. And I'll mention in Austin Community First Village, their anchor word is the word settle. And they took it out of Genesis, and God put man in the garden to settle and to cultivate. And so that's what, having your own place. You're not carrying your bags with you everywhere you go, and you're not sleeping with one eye open. Something about that they learned in Austin was that when people realized that they were settled, and it might be 3 months, 9 months, it depends, that 70% of the alcohol and drug usage that folks were using to mask their loneliness or their pain, whatever it was masking, went away when they truly were settled and felt the love of a community. So that community is it's what's, it's beyond housing first. It is living in community. Next slide, please. So this is just another view of the campus. The 3 buildings in the front there are the community center and medical and mental health and physical health and dentistry. Next slide. And this just shows you a tiny home. Will probably be closer to the 450 feet. In Austin, it's about 200 feet, but we will have bathrooms in ours, and our bathrooms will be ADA, because our folks may not be needing ADA when they come in, but they may need it 5 years. So this is permanent housing. So don't have to, it's not a prison, so they can leave, but they have a place for life. Next, please. So the community center, so this is something that's different than Austin. It's that the Catholic Worker Community Center will move to this site and providing 3 hot meals a day, Monday through Friday, and probably 1 on the weekend. And then we have partners like SAM Ministry, Center for Healthcare Services, any numerous San Antonio Dentistry, any numerous of partners to make the coalition viable. And we're blessed to be right on a Route 24, which is an early and frequent bus line. It goes right to the site. So That's very important, since pretty much none of our guests will have a vehicle. They just don't have cars. Next, please. And we'll have a multi-purpose chapel complex. It's not faith specific, and we can have guest speakers. We can have outdoor movies. It serves as an amphitheater, and the wings serve as places for training and different things. We're also just a walking distance from the ETSI Center, which has adult education. Next, please. And so we are a coalition of the caring, and these are some of the partners, and more are being added all the time. So the board is sort of facilitating. We're facilitators, to birth something that's bigger than all of us. And next, I think that's the last one. So we formed the board in 2017. Found the land in 2019, broke ground just in the last couple of months. And we're working on phase one while we're still fundraising. It's about a $27 million project, and we're more than halfway. Thank you.
Thank you, Mark. Let's hear from Brandee.
Good afternoon. Thank you for allowing me the opportunity to come speak on the many programs that the Housing Authority is currently providing to many different targeted populations. I know y'all heard earlier from Cecil King, and he is correct. SAHA and the center have been working together for years. And I think the most critical point is that open partnership and really better understanding the needs of our community and what my programs and their programs can offer to get our families that are experiencing mental health, the proper housing that they need. And so he touched a little bit on a project that him and I have been working on. It does seem like years, 5 to 6 years, but we are almost to that final end of that road to really where we get this launched. And we're really excited utilizing this as a pilot. And so he mentioned that it is at one of our public housing communities that currently has been undergoing a remodel. And so it's roughly about 185 public housing units. This community serves our elderly and our disabled population. And so what we recognize at the Housing Authority is that we can't do this alone, right? Housing is just one part of the fundamental, but we have to have support services. And so when Cecil and I began working together back in about 2012, when I was in our Housing Choice Voucher, most commonly known as our Section 8 program, we started brainstorming. How do we expand? We know we had vouchers that we allocated to the center and to other partners in the community, but what else can we do? And so he brought this initiative, and I am very passionate about mental health. I've told many of my staff, as well as the opportunity where I get to go sit on different committees and board, that I am impacted, or not, I wouldn't even say impacted. I live closely with family members that have mental health, and I find passionate because I've seen how many doors have shut when we start talking about mental health for them. And it's, instead of shutting doors, we wanted to open doors. And so this project, we have allocated a small number of public housing units to the center with the understanding that they're on site. We know that many of probably our current residents are already receiving some type of services through the center. And so we wanted to ensure that they could have the access, because that's the last thing we wanted to have is another barrier for our families to get access to health, to mental health services. And so we look forward to this partnership. I hope we are able to expand it in the future, but we really wanted to make sure that when we launch this, that we are successful. So that's an exciting project that we hope will come on, fingers crossed, by the end of this year. I think we all know, and obviously having this conference virtual, COVID has impacted us in many, many ways. And one of that is the launch of getting this pilot up and running. Outside of that, obviously, we have the Housing Choice Voucher program that I, again, over my years of leading that department, have been expanding through our partnerships, but recognizing the critical component of support services. I think many of us know that we can give someone a Housing Choice Voucher and they can go find a new home to live in. But unless we have those partners that are providing that support services, sometimes our families end up unsuccessful, and that's not what we want. Our goal is to keep our families housed, but at the same time providing them much needed resources. And so I have a variety of different programs that we administer through the Housing Choice Voucher and through partnerships like Center for Healthcare Services, Haven for Hope, Sam's Ministry, a number of partners in our community. So that's why I'm here today. It's just really kind of talk and answer questions about what we're doing at the Housing Authority to get more families connected to housing as well as those support services. So thank you for your time.
Thank you, Brandee. I'd like to share a few things about what we've been doing at NAMI and at Aspire. Back in 2018, we started talking about trying to do something upstream for persons living with a mental illness. We found that there wasn't much available to come to the home or a place for them to go and live permanently, where they were clustered amongst folks who were understanding and supportive of their issues, their illnesses, their ups and downs, those sorts of things. So in 2019, we started to study the issue, and we pulled together a number of stakeholders, some of whom I'm sure are on this call, began to discuss what was happening upstream to help people to avoid needing a policeman or needing to go to the state hospital in order to receive effective treatment. And what we learned was that there was a good bit of siloing going on in programs. And we also learned that there were a lot of good things going on and a lot of efforts to try to make the bridges which are necessary between organizations to make things work. And so I'm quite happy to hear what Brandee and Cecil are doing. And of course, like Mark, Chris has been part of my working life for many years, and I really respect what they're doing at the village. From the stakeholders, we discovered that there were two issues in the housing. One was it's not generally available to receive community services to wrap around their living situation. And secondly, over the years, we've moved away from creating programs that support cluster housing into scatter site housing. And so it makes it harder for people to receive support services, even from organizations who are able to provide them. And so we started to take a look at what needed to be done. And of course, what we discovered was there's a housing shortage. And so now we have a housing shortage, plus we have people that have a hard time keeping their home. And so we began to look at then what would be a good model. And I'm happy to say that as we talked to our stakeholder partners, what we learned was that everybody was thinking about this. And that what I hope we can do today is to have you share what you know and ask questions of us and talk about what the issues are. And I'll kind of finish my comments by saying this. A lot of the conversation is about what happens to somebody when they come out of the justice system or the state hospital with a mental illness, and how can they live in a stable manner. And so one of the things we looked at was how do you mitigate this recidivism, this having symptoms which result in problems, and then you end up back in the hospital or you end up out of your house. And so one of the things we learned there was that the wraparound services are just critical, and they need to be there in your community where you live or available to you on call as you need them. And so with those comments, I'd like to open up questions from all of you. So please feel free to send them to us individually, or ask a group question, or make a comment. We'd like to get this started. Thank you. Well, I'm not seeing any. Maybe that's because I'm new to this Zooming, but I think what I'll do then is to open it up. And Mark, could you share how you're going to do the wraparound services at the tiny village? How are you going to make that available to people who may also, not in addition to their issues with alcohol and drugs, but also they may have other medical conditions? Is there somebody that's going to be there?
Street medicine, dental. Something that I failed to mention, and I learned this from the Community First in Austin, is that when you're in community, meds are a wonderful thing, but we all know that our mind tells us 1,000 reasons why we should not take them. And then once we get off the meds, it's a slippery slope. And when you're in community, there's people are watching out and they're noticing that somebody's maybe acting a little bit different, and they can catch it sooner than when they're remote. But we're having, we just announced, just sent out a press release a couple of days ago that Edward Gonzalez from the city, who's retired from the city, will become our executive director, and Dr. Chris will manage the community center, the Catholic Worker, which will be expanded considerably from what we're doing now. And then we'll have probably somebody who will be managing all the partners and keeping the traffic, the airplanes landing on the right runway at the right time. So it's a work in progress, but it's also going to serve, there could be somebody in the neighborhood, they can come over and take advantage of the services. It's vital that we, one of the things we learned was the city and the county shared with us in public meetings that they need the model that we're doing, and not that it'll be perfect, but it needs to be all over the city because the homeless is all over the city. And so it's vital that our neighbors, when they get interviewed down the road and somebody wants to expand and they're citing us, that the neighbors, give us a thumbs up. And so part of what we're doing is be proactive and make sure that we invite the neighbors, they know what's going on, because the NIMBY is the number one thing that stops things like this from happening. We all know that. So we have a responsibility to the rest of the city that we do a good job in that area.
I have a question coming from someone, and this will be for Brandee and Mark. They're asking, will admissions be based specifically to HUD rules, or will there be discretion?
So Mark, do you want to take it for, I'm assuming maybe that came from the village, and I know I won't be able to answer that. I can answer the other about some
Sure.
of my other programs.
Well, at the village, its first criteria is 50 and older. And second one is chronically homeless. And I believe the definition of that is have been on the street for at least a year, not necessarily consecutive. We're looking to serve the ones that are the hardest to serve. So that's that's your criteria. If we get down to 2 people, both worthy of it, we'll probably take the one that needs it the most.
Brad, can you turn everybody's camera and mic on, please? We're having trouble with folks being able to use the chat.
So
I'm sorry, I was able to come off of mute, and I do have a question, but does everybody have the option to come off of mute?
I'm getting there.
I'll go ahead and answer that second part for the SAHA programs. Because we are required on our programs, HUD does have some requirements. in that we do have to screen for income, and we have to screen for criminal, as well as some other little things. But I will tell you, the Housing Authority it has adopted and continues to talk about housing as a human right. And so we are always looking at our policies to ensure that we can admit as many families as possible. There are some things that HUD does tell us we cannot provide housing assistance for, but those are really limited. And then even if there is some type of denial onto our program, all of our families that may be coming and trying to get onto our program, and if they are denied for some reason, we are able to provide them what we call with an informal kind of review, and then it can give us additional information that may have come up on a criminal history report that says that they have, maybe if there was something with, a misdemeanor, that they can show us and provide us that they have gone through some classes. And oftentimes, if they're already working with many of our partners and caseworkers within the community, those individuals will oftentimes write a letter on their behalf, and that usually gets our families admitted onto the program.
We're getting a little feedback from somebody. Maybe we need to stick to the chat room. I don't know, but thank you, Brandee. Jackie, I believe you had a question.
Yeah, I have a question and a tip, and I don't know if, and I will say that I had some experience before I retired in home apartments for the elderly. And one of the things that I hear a lot from the NAMI folks in looking at our NAMI apartments around town is they will waiting list, because when the apartments come up, lots of times they run through that waiting list really fast. And so people should not get discouraged. If the waiting list is long, put your name on the list and go find another list to get on. And I think it's unfortunate that people are so easily discouraged. I do have another question though. I've been in the NAMI office and had some phone calls I took last week. And one of the things, besides trying to get an adult family member into treatment, is finding housing for them. Are all of these things, do you have to go through a long process of approval, like for the SAHA Section 8 stuff? Or is it a matter of calling up and getting your name on the list, and does the approval process, or at least the assessment, run through pretty fast? And that would be Brandee or Cecil or Mr. Wittig.
So for some reason, I am unable to unmute myself. So thank you for the host who did unmute me. So it is, I apologize. And Jackie, I know you were talking a little bit, but unfortunately during your message, you got muted too. And I know you were talking and you probably didn't realize that, and none of us could unmute. So I think for the most part, I heard you talk about a lot of wait lists, and you are correct. There are, especially with my traditional programs, there is time, and don't get frustrated, but HUD does make every housing authority across the country go through some type of waiting list. But because we know it's critical, that, like I said, the housing authority understands that there are some critical needs in our community, and that's with my partnerships with Center for Healthcare Services, Haven for Hope. We are able to, because those come with support services, which is the difference between a regular housing choice voucher or coming in through the regular public housing. You are required to do that. There is some where you bypass the traditional wait time, but that's because you are being referred from one of my partners. Now, I will say that they may have some wait time as well, because they're serving, thousands of individuals too, but don't ever get discouraged.
That is true for Brandee. Here at the Center for Healthcare Services, because of their partnership that we have with SAHA, with TDHCA, with Health and Human Services, as well as Housing Authority of Bexar County. It has enabled us to get clients into housing quicker than the normal process. Prior to COVID, we were getting folks housed within a month from the time we get the referral and get everything in place. Now, due to COVID, everything is kind of stretching out longer and so forth, but we're still able to get folks into housing. We currently at the center have capacity, resources to get like 405 folks housed. So we do pretty good. And everyone that we house through these special set-aside programs through SAHA or HABC, they receive their traditional supported housing services, is where they'll have a care manager, housing specialist that's attached to them. And we see them a minimum of one time per week based on their needs. If the needs that they have is greater, then we may see them twice a week or whatever that may be. Doing this model and operating underneath this traditional supported housing model, we have been able to, we collect data every month on different areas, such as housing stability, how long they're staying in their apartment before we're seeing issues. We're also looking at eviction, broken leases, abandonment of the unit, mental health hospitalization, addiction, inpatient services, and so forth. So we look at all of them to see, try to determine if the services that we are providing to them individualized in their home, is it working, or do we need to tweak something? And through we just finished July, through July, we're sitting at 92% housing stability rate. We're also, I took some numbers. We're looking at broken lease. Out of the people that we serve, about 2% of them will probably wind up, broken lease, hospitalization, or any type of inpatient, about 5%. Homeless, returning back to a homeless situation, 3%. And these figures come from a total served for the year of 449 clients that we have served from September 1 through July 31st. So what that is telling me, these type of data and these type of numbers that we're seeing is telling me what we're doing and CHCA supported housing team, it's working. We're getting folks housed and we're keeping them in-house longer than as if they didn't have the support, the in-home support. Without the in-home support, what we see within about 3 months or less, they're either getting evicted or they're leaving, abandoned in the unit because of their illness. They leave, or sometimes they may get a note from the apartment management that says that you need to vacate in 3 days. So they get that and they pack up their stuff and they leave, not knowing that you don't necessarily have to get out in 3 days. Now, over the years, I think CHC's supported housing program is effective because we follow the traditional supported housing model. And it's also a plus because before I became the leader of this division, I was also one of the boots on the ground. I was a supported housing care manager. So I knew, what it takes to get them into housing, and I knew what it takes to keep them there. And what to get them there is partnership with, agency like SAHA, HABC, as well as developing great working relationship with landlords and owners. That helps a whole lot. I've also learned that when it comes to landlords, opening their doors and helping folks that has several different things on their background, it's not that they don't really want to help, okay? Some of it is due to lack of understanding of the population, lack of education about the population, and not knowing what to do in the event that something happened. Those partnerships with these landlords, now they know that if we have a client that from CHCA supported housing team, we know who to call. And we know if we call them, they're going to come out and work with the client to keep them housed. And that's fine. The landlord likes that. They work with us on that.
Thank you. We had a question. What would be the services currently available in our community for a 44-year-old single woman with mental illness in need of stable housing with supportive services, including supervision of medication? What do we have going for that here?
I know with us at the center, if they are connected to the Center for Healthcare Services for their mental health treatment, then we will serve them, because we do have the capacity and then the resource to serve them. If they're not connected to mental health treatment and they want treatment through the Center for Healthcare Services, we'll be more than happy to serve them. They just need to call our intake line at 210-261-1250. And once they go in, if housing is an issue for them, then that issue will be addressed.
Okay, the next one is, let's see if I can get this thing working right here. So if there's permanent housing for individuals who have lived in mental health group homes for years and desire to live independently, but are care managers available? So if you want to go from a group home to living independently, is there a program out there to help them make the transition and then support them later on?
We have we've had several clients who were in, as a matter of fact, we got a referral last week on an individual who's been in a group home for quite some time now, and she wants to have her own apartment, and her treatment team feels that she's ready for that independence. So they made the referral to us, and we're reaching out to her to do before we serve him. We complete a face-to-face supported housing assessment and transitional plan on each one of our clients. Now, the assessment basically look at their past and current living experience. How did they do when they try to live before without the support and so forth? It also identifies several skill areas such as cooking, money management, paying bills, and so forth, understanding their illness, developing coping skill. Whatever those areas are that was the downfall of them not being successful, we target those areas, and those are the areas that we work on that will help them to be successful in the community by themselves. So we are doing that.
Okay, and another question was, what kind of mental health group homes are we talking about? Board and care, HCS, HCBS, AMH. Do we have a variety of group homes available to us here in San Antonio?
Well, the city of San Antonio maintain a list of all licensed facility that's in the community. We have that list as well. So in the event that we should get a referral on an individual that says, and we've had one about a month ago who was at Haven, he didn't want to stay at Haven anymore. He wanted to move, but he was afraid to live in an apartment by himself. So he elected to go into a licensed boarding home. So we were able to get him connected to that boarding home, and he's there. We also let him know that in the event that he's at the boarding home and he's ready to return back to an integrated community, then we'd be more than happy to help him with that transition.
Very good.
Bill, I think Eric has been patiently waiting to answer.
Eric, I'm sorry. I apologize, Eric. Please go ahead.
So he may need to be unmuted from our host.
Thank you, Brandee.
You're welcome.
I'm
good looking out, Brandee.
The other way.
I'm trying, y'all. I'm trying to monitor everything. Bill, I know how it feels to be in your seat. Believe me.
Eric, can you talk? Have you been unmuted yet?
No, he's not unmuted.
Unmute, Eric. Oh, there
He
you
is
are.
now.
Hey, hello. So I'm Eric. I'm with the City of San Antonio now, Department of Human Services in the homeless division, and the newly put together outreach team. I am one of the 4 clinicians. We're about to add a 5th to that team. And it's more of a comment, not necessarily a question. So we're providing outreach to the unsheltered and also providing clinical mental health services to help some of those folks through those stages of change to eventually go to safer places. In doing so, a lot of what we come across is people that are experiencing, some serious mental illness, substance use, or a combination of that, and also some physical health. And most of them are not funded. They don't have access to healthcare or any of those other things. So the fortunate thing with having the mental health clinicians, we can provide that little bit of service to them. And so getting them access is our biggest barrier, which I'm sure most of you come across as well. So we will continue to support all the efforts that CHCS and SAHA and everybody else does as well. But mostly I just wanted to kind of let this community know that is taking place, that there are mental health clinicians providing services in the streets, literally where the people are. And we're doing what we can to help those folks transition and recover from homelessness.
Thank you.
Thank
It
you,
brings
Eric.
up a good point, though. Do we have enough navigation or enough people who understand navigation in order to help people be eligible for all of the services and programs they need in order to live in a permanent situation? Our stakeholders shared with us that navigation is very important, because if you're not eligible, then you can't make use of those services. And it seems to be more difficult for those who live independently in the community to obtain those eligibilities and then maintain them.
I
One
think
person,
with the mental health population, I look at it as when it comes to service, housing and recovery, I look at it as a kind of a 2-tier model. Whereas the first tier is where you work with that individual to identify, their skill deficit areas and barriers and challenges and so forth, as well as identify the type of housing or location that that individual would like to reside in. Because for me, I think when you're trying to help someone get into stable living environment, choice is essential to that. Having that choice to choose where they want to live and so forth, and what they want to, where they want to be and what type of housing, it helps a lot with their recovery, because it's not something that's being forced upon them. This is something that they are choosing to engage into. And the next next tier is where we call the maintenance tier, because we know that getting someone into housing that had chronic mental illness, it doesn't end there, because they will need those support inside the home to keep that home, to operate that home on a daily basis, to know how to develop relationship within that community so they feel a sense of belonging to that community, how to advocate for themselves in terms of getting repairs and maintenance taken care of within that household, how to making sure that they prioritize their bills on a monthly basis to make sure that, number one, their rent and their utility get paid on time, understanding their lease in terms of what to do, what not to do, and so forth, and teaching them those things and constantly reteaching and those kind of things help them to maintain that housing and ensure housing stability. And those are the type of things that we do at the CHCA supported housing program. It's a traditional supported housing model, and it works. You know, the data we collect and the evidence that we have shows that what we're doing does work.
Thank you. One person mentioned that Dallas County Housing Choice Voucher Program has a closed waiting list. And this has been our history here locally. Does anyone on the panel have any knowledge of innovative models being considered in Dallas County? Also, as part of the American Indian community, is anyone aware of housing money designated specifically for urban tribal people? Our urban intertribal center can only help with 1 month's rent assistance, and only if they are enrolled in one of their programs. Does anybody know anything about this?
Well, earlier in your introduction, Bill, you mentioned that I was nominated by my peers to testify in front of the Texas Budget Legislative Committee. And part of that, you know, gave HHSC the authority to set aside housing dollars for local mental health authorities. We started that pilot back in 2012. In 2012, and out of that, we received funding to serve 40 individuals with rent and utility for up to 1 year. That year, we wound up serving over 65 people with that money. Now, since then till now, that program now is not a pilot anymore. It's now a permanent program where we receive about $700,000 each year to serve 80 clients. Now, during the COVID time period, we serve 149 with that money because the need was so great. Okay. Now, Dallas County, I'm not sure if they are receiving that funding, but if they're not, they should reach out to HHSC. That funding helps a great deal because what it does for us, we utilize that funding as a bridge. Whereas we get someone that's homeless in the street, we can utilize that money to get them housed quicker while we find alternative housing for them. It also helps in terms of homeless prevention. You know, if they have an eviction notice where they fell behind on their rent, wasn't able to pay their rent and stuff, we can use that funding to bridge them until they're able to move forward.
So I'd like to add, Cecil, I'd like to add, just because it looks like they're talking a lot about the wait list, and especially when we know that the housing choice wait list is out there. And so Dallas County, unfortunately, is not unique to what other housing authorities across the country are dealing with, just like the Housing Authority of San Antonio. And so Saha's waitlist has been closed for our Housing Choice Voucher program since 2017. We will be opening it up for a small period of time, beginning September 1st to the 17th, and accepting applications. And then we will be doing a lottery about keeping about 5,000. So it is, you know, it's one of the hardest things at running these programs is to know that there's such a tremendous need, not just in the city of San Antonio, but across the country. And so I feel what other housing authorities are doing, such as Dallas County, they can't open it. And it's oftentimes is when we open our wait list, we have to manage. We don't want to quote, you know, that you're going to wait 5 to 10 years for housing because your critical needs are now. And so that's where the balance is. But oftentimes, and again, not knowing everything specific about Dallas County, housing authorities work with their local mental health providers, such as Center for Healthcare Services here in San Antonio. So there may be programs that you just need to maybe make that connection up in Dallas County to your mental health provider, as well as the housing authority. And there may be some ways, even though their wait list is closed, just like mine was currently, I still have these partnerships that allow me to issue vouchers to individuals that are coming from these referral programs. The other thing is utilizing what we call our COC, which is the Continuum of Care organizations. They are the organizations that are supposed to be assisting our homeless populations, and most, especially large areas such as Dallas, have a COC. And so there's other resources that you can reach out to, finding that sometimes it's the housing authority that administers that, but sometimes it's a local homeless provider that does the same thing. And so there's it's sometimes hard, but it's navigating and getting through those systems. But I would start with your housing authority up there and asking them if they have some special programs that they are for targeted populations, such as mental health, and see if you could help. It'll help you get stable housing up there in Dallas.
Thank you, Brandee.
Mm-hmm.
Yes, and the next question has to do with criminal justice. Homeless individuals are often let out of the Bexar County Jail late in the evening. This is a vital disconnect. How can we ensure that these individuals are offered some type of temporary housing so that they are not sleeping downtown in the streets? I'm going to start a comment about this, and then all of you weigh in. The folks at Haven for Hope have really done an outstanding job, as have many others. But it's the one that I'm just most recently aware of, which is that anyone who presents themselves there has a place to stay. They don't turn anybody away. So there's one I know of. Go ahead.
Well, yeah, I was about to say the same thing, Bill, that Haven does have a jail release program that, you know, folks that coming out of jail, you know, Haven do provide a place for them to stay here.
The city has a homeless hotline, and I'll just give the number out, 210-207-1799, and also 311 now is taking reports of encampments and people experiencing homelessness that will come to us at DHS. So that was shared. Choice is critical, it's crucial. And this is a discussion that needs to happen around HCS waivers and the HCBS AMH entitlement programs, home and community-based services, adult mental health services within these programs. In Texas, Texas does not permit usage of these funds in a more intentional setting, though CMS has clarified these settings are not to be excluded from these programs. And this was shared. Any thoughts on these last things that I've read to everyone? Is there much choice? How do you guys deal with choice? People's choices are always very unique, very individual, and the community offers only a certain amount of things, but they're critical things. Do we have part of the system, a conversation with the person about what they would like, what they understand they need?
I think when you talk about choice, and like I said before, I'm a big believer when it comes to choice that people should be able to have some kind of choice in their housing situation. It makes it very difficult when it comes to working with individuals who have felony convictions, violent convictions on their record. And even though we develop partnership with various different type of second chance properties and so forth, at times it still become very challenging and very difficult. Give you an example. We have an individual that we were able to get a voucher, mainstream voucher through HABC4. And for him to go out and find an apartment, it took about 2 months to actually find a property that says, okay, we will give this individual a chance, but you will have to pay a second non-refundable deposit, to house that person. Yes, we were able to find a resource to help him with it, but in most cases, we're not able to do that. So I think there has to be some kind of law that comes down from the federal government that, help us to help those people to reconnect to society and rehabilitate by giving them a chance of stable living environment, because having that, it does give them hope. If they have a stable place to live, it gives them hope. And a lot of time, that's what some of these folks need. They need a sense of hope.
And I'd have to agree with Cecil. Oftentimes, not just our families that have support services through the center. We know that just sometimes by the nature of having a housing choice voucher, that there are landlords in the city of San Antonio or across the country that just don't want to. I heard someone say NIMBY earlier, and unfortunately, that's still we're still faced with that every single day. They support some of the programs, but just not in their neighborhood. And so I think what Cecil and his team and other folks, other partners that we have, are going out and having conversations. And if they recognize that it's not just a family that's coming by themselves with many of the barriers that they face every day, but they have that support system through a case manager, we are gaining some traction with individuals willing to lease those units to these families that really do need that stable housing. But until I think we could start changing the perception of NIMBYism in our community, it's still going to be a hard barrier for anybody to face. And so as much as we want to promote choice, sometimes our choice is still limited because of that. But there are some excellent landlords out there that have recognized that with the partnerships and the establishment of just that case management and support services, they have some very, very successful families living in their units, and they are pleased. And they know that they not only can call, the housing authority, but they could also call some type of case management and help intervene, because we often know mental health, it's not something that the family chooses to go down a path. It's oftentimes maybe the lack of having that support system. Maybe they, failed to take their medicine. And so it's recognizing that and being able to communicate. So hopefully in time, between all the work that we're all doing, that it will change that perception across our community.
Thank you.
In our village, we addressing choice by designing RVs. We'll have 25 and then 100 tiny homes and 80 apartments. So there's some element of choice for the individual.
Eric, I see your hands up, and then Cliff, I see yours too. Eric, there, if we could unmute Eric. There you go.
Yeah, I was just going to speak on the choice a little bit. A lot of the folks that we come across, we see their main problem as housing. And in conversations with them, their main problem is not housing. So, with self-determination and them being okay with them making those choices that we see as detrimental to themselves. And then most of the work that we're doing out there is trying to help them understand that some of the choices they're making are less safe. And so in a overall holistic harm reduction view of, maybe not right here in the entry of a business that's on the Riverwalk, maybe we can move to a safer location. If it's not shelter or other things, and it takes a long time sometimes, to be honest. Building that rapport and those relationships is essential to, at least for us, getting those folks to trust us enough to be okay with challenging those choices and seeing that housing is a problem for them.
Eric, you bring up an excellent point, and that is, do we have enough peer support in the city? to help people who are going through quite a complicated process, whether it's hospitalization or criminal justice or whatever? Do they have enough peer support to help them work through that when they may not feel good, they may still have some symptoms? What are your thoughts on whether or not we have enough peer support? I understand you can be certified in it, but it seems to me like it's a critical part of making all this work. There's a lot of cooperation necessary in order to keep all these programs going to support you. Sorry, go ahead.
No, I was gonna say, yeah, excellent question. No, I don't think we have enough peer support, certified peer support in the community. I think we need it, and it has proven time and time again that, you know, peer support does help folks through their recovery. There has to be a way of getting, you know, folks. I know many years ago that it was made where folks who wanted to be certified as a peer, they went through the training and it was covered through the state. I think we need to have something like that back again, because some of our clients that graduate from supported housing program would love to become a certified peer specialist.
Brandee, do they have anything under HUD for peer support at all?
No, not as of recently, though. Bill, I am hopeful that the conversations are going to be changing. The Housing Authority is actually looking at that through some of our programs that we have, through we oversee Community Development Initiative that helps with support services coordination, but we also are exploring that peer-to-peer support because we think it's critical.
Mark, are you guys planning to have any of that available in the tiny?
Yes, we want to have some peers on campus, and that's part of our plan.
Cliff, you've been patient. Could we unmute Cliff? He has a question for us. Okay, Cliff.
Hi, can you guys hear me?
Yes.
I am a certified peer specialist and I am a licensed clinical social worker. And I used to work closely with the VA's homeless program. Screening and case management is going to be very important for those who get into the housing. There's a lot of people who we know how vital housing is to their recovery and so necessary, but if they're not taking their medications, we placed one patient one time, he always wanted to have his little nightly fires on the floor, and he would set apartments on fire. But that's the reason why it's going to be very important to screen who you get into these stable housing communities and to have peer support and some sort of management. Now, as far as peer support, that 40-hour program that was run out of Ulster, it is an outstanding peer support program. And many of those peers are employed. The VA actually employs peer support specialists on their mental health teams.
Well, thank you for that. An observation. It seems to me like peer support, navigation, these sorts of things are very difficult to get funded on a permanent or continuous basis. So I see funding as potentially an issue there. When you have a large organization like VA that understands this to the point to where they pay for it, that's a wonderful sign. That's one segment of the population. One of the things that I've noticed has been a common theme through our conversation today is that certain organizations have the authority to do this, but they don't have enough funding to meet the demands of all the people who could benefit from the service. And as a result, it impacts other programs and their ability to keep people who may be living with a mental illness, or they may be living with a drug addiction or a criminal justice history, to be able to remain permanently housed. And we know with permanent housing comes health, stability, perhaps employment. In other words, you get a chance to participate in the community. you guys have any thoughts on this issue of funding or on the necessity for these three, which I consider distinct services: navigation, case management, and peer support?
I'd like to suggest again one thing, and I put it in the comment section also, that where our son lives, he has a provider through CMS, just like was mentioned. We were told when he was a senior in high school, his schizophrenia was so bad that we needed to find a place that's locked for him. He would never live on his own. He has been in this same NAMI apartment for 11 years. And the last couple of years, we've used the provider service that he has available to him because of his insurance. But also in this apartment where he is, the apartment manager has also been there many years. She's taken family to family, and she knows how to problem solve with these folks a lot better. And in that regard, she can get in ahead of the game before somebody does something to offend and pull in the supports that person has. And I would suggest peer support programs that you're talking about are wonderful. If apartment managers can qualify themselves to become a peer specialist, hooray, that's great too. There are all kinds of programs out there that funding's available for, or they're free. Our family to family services training are free through NAMI. Right. So any of those things can be used and are out there right now. And of course, I know, Cecil, you're the choir. I'm talking, you know what I'm talking about. I really appreciate what you do and what all of you do so very much. But I worked with Cecil with NAMI some years ago. So good to see you.
Yeah.
Jackie, I think that's an excellent point. And I wrote that down. And so as we're always as an organization looking, how do we better train our staff, not just at the almost 70 public housing facilities that we own and operate. How do we get that? And so I definitely have that on my to-do list to kind of start investigating that and looking at that, because I think any way to make our staff better equipped to handle these situations, whether it's talking with the individual with the mental health or trying to talk to the other residents so that don't understand the whole mental health, right? I think that's the other thing that we are trying to balance as property managers day in and day out, that we recognize that there's something going on, but their neighbor does not. And so how do we better equip individuals in the community working at these properties to understand and balance all of that? So thank you for that. That is definitely something I actually am putting 3 stars by to get started on Monday.
Right.
I would like to kind of return to one that was brought up. How do we expand our programs to serve more people, especially in the area of permanent housing with wraparound services? Mark, you guys are doing something substantial in that area. I understand from you, Brandee, and you, Cecil, that this is going to happen at one of your locations to expand this. What else can be done in the community? NAMI reaches out to everyone, and we love to talk to bankers and investors and builders and those folks, and get the family to family out there, or any one of a number of our educational programs, because they do have a very positive impact. But what can we do as a group that's gathered here today to just encourage more housing with wraparound services, and if possible, clustered housing?
Hi.
Go ahead.
Okay. Hi, my name is April, and I teach mental health nursing at University of the Incarnate Word. And I've been to NAMI's family to families training and some other training with NAMI. So I make sure I incorporate NAMI into my clinical training with my nursing students. So I just want to give a positive comment about one of my students who graduated 3 years ago and moved to San Francisco. What she does is she works in a community program where she puts a backpack on her back and she does street medicine, street nursing. So she goes out into the community and identifies those people who need services, mental health services. And she can also identify, who needs medication and work with the community on that, which I think is an excellent program because she has the nursing background of working in a mental health facility and knowing, what patients need as far as Risperidol and, what have you. Now, I think we need something like that in the San Antonio area because we do have people trained in mental health nursing. And I just think street medicine is the way to go. We need to go where they are. And I also worked with the osteopathic medicine school for UIW. And we have a doctor that goes under the bridge and he takes the medical students with him to learn how to do street medicine. So, that's my plug that I think in a community, we need to do more of this, do street medicine. And, with people who have the background to identify folks that need treatment and get them the treatment they need. So that's all I have to say.
Thank you.
Very well spoken, Miss April. I think you hit it on the nail. Bringing the services to them. A lot of folks who has that chronic mental illness, who's out there in underneath the bridge at the homeless campsite and so forth, they're not going to come into service.
Yeah.
So you'll have to somehow figure out a way how to bring that service to them.
April, I absolutely agree. I think that one of the first steps that the Housing Authority and the center are taking, right, is we're bringing mental health clinics on location. And so there are no barriers. We're also, as the Housing Authority, we're expanding our partnerships in our community. UIW is one of them, and how maybe bringing nursing students on site, not just the mental health, but other things, right? We know there's so many other critical needs, especially for the programs we serve. I serve low income individuals in our community. And so it's critical that we no longer stop as a community and say they need to go seek it. It's we're bringing the resources to our families in hopes that they say, okay, it's much easier for me. They now have them on location. We're having those conversations day in and day out. And so I think we're all heading in that right direction instead of, keep saying, well, why aren't they going? It's no, why aren't we there for them? And so that is kind of the model that we are.
There's some excellent.
Yeah, that's the model we're trying to shift.
I'm sorry, go ahead.
No, go
The
ahead.
VA has a mental health intensive case management program where a lot of times the social workers and the nurses, they will actually go out to visit veterans under the streets or take them their meds if they don't show up for appointments, or if they try to go out to the very hard to serve. I thought last year or something, I heard about a program in Bexar County where we had some field people who actually go out and visit the homeless and try to tell them about services, maybe at the homeless shelter and other places. Does Bexar County still have a program where they have outreach workers that go out among the homeless? Is there such a program?
Yes, I believe
do.
Eric can address that.
Yeah.
Yes, they do.
Yeah, there's the city's outreach team started in January/February. Before that, Haven had some folks, Centro downtown, Sam Ministries was filling the gap for quite a long time. They still are providing outreach. So there, before the pandemic, the group of outreach folks was much smaller. and it has expanded since then with a strategic plan that was put together right before that. And then, with a lot of the CARES Act funding that gave us the ability to really move the stick pretty fast. So there is a lot more outreach taking place, and also putting it together to what it looks like for San Antonio.
Thank you. Have we enough planning, and do we understand enough what is going to happen to all the people who are going through the justice system, the inpatient system? They're ending in these transitional programs like Haven and many others, and they're being released into the community, but it seems that there is a lot of transition going on, but I'm not sure how much permanent housing is going on to meet the needs of this growing group of people. What I hear is that they're needing to stay longer because they realize they need the assistance. But also going back to something I think Cecil said, which is, if you tell someone, you ask them how they're doing in a transition program, and they say, I'm doing great. And then you say to them, well, in a year, you're going to be gone. This can have quite an effect on them unless you have someplace for them to go. Mark's program offers us a place. Where else are there places? Have we been able to get apartment complexes or other people interested who will allow for wraparound?
I can't think of I think Merced Housing Inc. Texas does have some of their properties with those type of wraparound on site. Merced, MERCED, Merced Housing Inc.
I think, Bill, that's you just kind of hit it right. There's limited currently in our community, and I think
Right.
that's where this is a start, right? Getting organizations and partners together to see how do we get this done. I know oftentimes, I'm on other groups and trying to figure this out, and everything comes back to funding. And so I think as a community, we need to start figuring out how do we get this done? What opportunities are there to bring funding into San Antonio to get these developments that are critical for the families that really need it and need that wraparound services.
One last thought is, as we come close to the end of our time, one of the reasons why we need to work very hard on this permanent housing, this long-term solution, is because a number of these programs that do pay for things have a limit in terms of the total number of days of treatment you can receive and other problems like that. So if you don't mitigate things after one comes out of the hospital, they're going to go back in, but they'll be getting less and less care. So they're coming out maybe with more problems the more times they sort of cycle through the health system. And any thoughts on that? Any thoughts on problems with folks who end up with bad reputations, which we brought up earlier too? We just have a couple of minutes left, so if each one of you wants to comment on that or say something else as we close this out, please do.
I'll just say that
Go ahead.
we want to do our project well. We're still raising money, but do it well so that others will want to take it and add their own sauce to it, but so that it can be emulated, because the need is, throughout the city.
Yeah.
Brandee?
I agree with what Mark said. I mean, I think that's what we need to continue to do, Bill.
Cecil?
Yeah, I'll echo the same thing. I think Twin Town Village will be a shining example of what this community needs. And, for others to take a look at it and build on it moving forward. so that we be able to have an upper hand on this homeless and housing crisis that's in our community.
Thank you all so much for presenting, and thank you all for attending. We appreciate all the comments, all the questions, and all of the chat remarks. You can find a recording on NAMI San Antonio YouTube channel of this event, and you can find some more information on Pathways to Hope website after the conference, if you'd like a copy of the slides or whatever. And as we close out the session, post-workshop surveys will pop up in your browser. We value your thoughts, and we really appreciate this because we do use it in the future. Also, it's required that you complete the survey if you want your CEUs. Thank you very much again, and thank you all, panel, for presenting today.
Thank you so much.
Thank you all for having me.
Thank you.
Bye-bye.
Bye.
Have a good day.
Good job, Bill.